Thank you for making us the number one radio station inside the 7 o'clock hour. It's all about you, brought to you by the great folks over there at the Premier Health and Wellness Center. Good morning, Doc. How
Good
are you?
morning, good morning, good morning. How are you this morning?
I'm good. It's Friday.
That's great. I'm glad to see you looking delightful today.
You look very well today, Doc. Thank
Thank you very much. Thank you very much.
So, are you throwing me a case study today?
I'll be throwing you a case study
Oh,
today.
goodness. All right.
So she's 56 years old,
Mm-hmm.
and she presented to the hospital with an intense pain in the center of her chest.
Okay.
Do you have any questions about this lady?
Give me some more information. Is
Very
she
good.
obese?
She is obese.
Mm-hmm.
She's an obese lady, and she said that she noticed this just came on when she was sitting down at her desk at her job, and she started noticing that she was having palpitations and had chest pain. They called 911, and the ambulance brought into the hospital.
Okay. Is she having a mild heart attack?
Okay, so they did an EKG
Okay.
to see if there's any changes in the heart, and the EKG really was normal. It was tachycardic. It just showed that her heart was beating fast.
Mm-hmm.
So that was pretty much all that they had, and so they looked at her blood work.
Mm-hmm.
She was a diabetic,
Yes.
but her blood sugar was normal.
Mm. She's not having a mild heart attack. Her blood sugar is normal. She's obese. She is diabetic. EKG, everything was fine.
So a little bit more about her. She works in an office setting,
Mm-hmm.
and they throw a lot of paperwork at her. She has a lot of work to do.
She's sitting a lot,
She sits a lot. She's sedentary.
typing.
She's a typist, and this is a little challenging because I'm intentionally going to mix a couple risk factors, but where it ends up, I think you'll be very much shocked and surprised.
I'm laughing already.
Okay, so we have her, a little bit more about her. She's been divorced, and she has 3 children. That one is in his 20s, the other one in his teens.
Is she stressed?
She has stress. She has
Okay.
stress.
And she's not having any type of panic attacks.
You messed up the whole question.
Okay.
Yeah, she's having panic attack.
Okay. Well, when you said she's divorced, I'm like, okay, that's drama to a certain extent.
Right,
And then children, and she works a lot.
right,
So, stressed, panic attacks.
right.
So, does these panic attacks come on normally?
So it's a good question. Has she had it before? She's had it before.
Okay.
So panic attacks can be an intense sense of fear.
Mm-hmm.
Some people feel like they're having a heart attack, and this was her presenting symptoms. She had chest pain, and she had been to the hospital 4 times before for this.
Mm.
And they did blood work, they've done EKGs, they've done a number of studies, and they weren't able to find out what was the cause.
Mm-hmm.
Her mother also suffered from panic attacks.
So, this is hereditary.
There is a potential genetic predisposition toward having panic attacks.
Mm-hmm.
A little bit more about her. She sometimes gets the blues, where she feels down, doesn't feel good about herself, self-worth issues.
So, depression kicks in.
Yeah, so comorbid factor, something that goes along with panic attacks and anxiety, it can be depression.
Mm.
So people who have what we call affective disorder, that is the anxiety and depression, are predisposed to having panic attacks. But you don't have to have a history of anxiety or depression to have panic attacks. Some people have them because of intense amount of stress, and the symptoms can be from stomach disturbance, chest disturbance. Some people said they felt like they're just going to go crazy, and they wind up having to have treatment for that.
Interesting.
Yeah, it's more common than we expect, than we think it is. That anxiety and depression are common disorders that go untreated often and can really mess up somebody's life, can really cause you to have intense fear. There's something called agoraphobia, and that's when people can't really be around a lot of people.
Correct.
Because they have this intense fear that perhaps I'm going to have another panic attack.
Mm.
And so they maybe even shouted in their home because they said, listen, I don't want to have this panic attack in front of people. So the fear that I may have a panic attack can actually predispose you to having more panic attacks.
So, is there a slight difference, feeling-wise, when someone is having a panic attack versus a heart attack?
Well, yeah, because a heart attack can present with a number of symptoms. Some can be sense of pressure in the center of the chest. It could be pressure or intense pain going down the left side of the arm. There's some people who have a pain that goes up to the jaw. I've seen an instance where pain went straight to this gentleman's back when he was having these symptoms. There is also the possibility of GI, gastrointestinal dyspepsia, feeling like it's like an ulcer, pain in the stomach. So while those variant of reasons why someone may have symptoms why a person may be having a heart attack, it is indeed the most common that you have a suppression in the center of your chest, like an elephant is sitting on your chest, or pain that radiates on the left side of the arm. However, with panic attacks, because it's in the central region, the chest region, people kind of just assume that I'm having a heart attack because they say, well, it's in my chest, so it must be my heart. And it's really anxiety causing your heart to run fast, causing you to become short of breath and shallow breathing, and causing constriction of your airway.
So people having panic attacks, doc, if that is that's common for individuals?
It's more common than we would like to think. Yeah, there's a certain percentage of people that actually have panic attacks, and it's very debilitating to be able to say, I don't know what's going on, I don't know if I'm losing it, I don't know if it's my heart. And what's amazing is that the person who has had a panic attack may know it's a panic attack that comes on, and the symptoms can be so devastating that they present to the emergency room or to their care provider repeatedly with the same symptoms. And it can be just so debilitating to have an anxiety attack. Yeah, so this is something that I think people should be aware of, and that there's effective treatment that's available for the acute episode when it's happening, and also preventive medicines that you can take to prevent it from coming back on.
How does one know that they are having these panic attacks? Like, do they just feel different?
Well, yeah, there is this dysphoria, feeling of depersonalization, like like you feel like it's not real. It seems like you're losing it. Your lips can get cold. Your hands can tremble. Your heart can beat very fast. Again, you can have GI disturbances, loose stomach, all these anxiety symptoms associated with a panic attack. And it's something that I think people are embarrassed about. Often people feel ashamed about the fact that they actually suffer from anxiety or panic disorder, and they kind of hide it, and they don't know quite what to do about it.
Correct.
And as a result, they suffer silently. But I think it's something that one should feel comfortable approaching your care provider about and seeing if you can get some assistance. Now, one of the things that this particular patient had, she had some risk factors for heart disease.
Okay.
She was obese, she was a diabetic, and more than likely and had these chest pain symptoms. So it's reasonable for a person to go in to be evaluated to see if this is a heart issue versus an anxiety issue. Right. And that's what they'll do at the hospital, to check your enzymes to see if you're actually leaking troponin, to see if there's actually an acute coronary syndrome, look at the EKG to see if there's any changes. And so if you are having chest symptoms, I think you should present to the emergency department, because just as much as she was having a panic attack on this instance, she could very well have had a heart attack because she had risk factors for that.
Correct.
So don't reduce it to, I just have a panic attack.
Right.
And it could be the real one.
It could be, or some people just like, oh, I guess I'm stressed.
Right. Heart disease is the leading cause of premature death in Bermuda, and risk factors for the heart disease are diabetes, high blood pressure, cholesterol, and patients who have those diseases at a higher rate of having a heart attack. But diabetes makes you 4 times more likely to have a heart attack, and pre-diabetes, it makes you 2 times as likely to have a heart attack than the average person. So just because you have pre-diabetes doesn't mean that you're not at risk for heart disease. And diabetes, you're 4 times more likely to have a heart attack than someone who does not have diabetes. So as an aside, though that's the primary case today was anxiety, the symptom being chest pain, and diagnosing it as a distinction between chest pain from coronary artery disease versus anxiety. On the subject of coronary artery disease, because it's such a major illness in Bermuda, if you have diabetes, if you have high blood pressure, if you have cholesterol problems, you have 4 times more likely to have a heart attack. That's more likely to cause you premature death, meaning you may die early, or have disability, suffering from, the effect of having a heart attack, or even strokes, another area in which a person have a great degree of disability as a result of that particular disease process. So risk factors for cardiovascular disease need to be always highlighted because we have a large percentage of our costs goes to overseas travel.
Correct.
People have to be overseas evac to a facility in the United States to get intervention. Medications are expensive. Hospitalization is expensive. So the cost burden to the society is another thing we need to talk about, why it's important to reduce our risk factors. And so programs like the Diabetes Reversal Program,
How is that going?
excellent.
Okay.
Patients are actually experiencing great relief. We've seen people come into the program and after a year have lost significant weight, gotten off a lot of medication, living a much healthier life, and just seemingly like they just didn't know that was possible to actually not have to live with the scourge of diabetes for all their life.